หน้าหลังล็อกโป้งปลายข้อ
Well, first we have been asked by the Ministry of Health, the government of Thailand to come and sort of in the project of improving actually patient safety and infection control all over the country. Of course, you cannot deal with the entire country, so you start with the basics. And in this case, we have chosen to actually work with the Ministries of Health hospitals. So hospitals that were selected by the Ministry of Health who came for a train the trainers program. We developed the same type of train the trainers program that we do all over the world, but of course with some specificity for the country and for the type of healthcare workers that attended the program. But the problem is that you are using the soap and the alcohol. Not good. You should use only the alcohol. So at the beginning, people are a little shy. As soon as we move to scenarios, which is active participation of all the people in training, then you feel that people are back to their daily life and the activity and the interaction is a lot better.
You have the grill. You could also try to do the grill.
The challenge for a teacher in Train the Trainer is to adapt to the participants' different experience level in hand hygiene.
What I liked the most in this Train the Trainers program in Bangkok actually was this new activity that we performed here where participants from the same hospitals, they were invited for together coming up with the plans to develop their hand hygiene programs in their hospitals, way of improving them. And then this action plan would be presented to everybody, and then they would get real-time feedback both from Professor Pite, from the team, and from all other participants.
This is very good. It means that the top people of the hospital are really endorsing the campaign.
ก็ในการเรียนครั้งใน3วันนี้ค่ะเราก็จะเอาไปใช้ในการปรับปรุง compliance อัตราการล้างมือในโรงพยาบาลเราค่ะแล้วก็เพื่อจะรู้ว่าแล้วก็เอาไปเป็นเหมือนตัวแทนที่จะไปอบรมคนอื่นต่อไป
I learned a lot of anything. So the first step I learned is about to self-evaluation. First, we must know where we are in the infectious control. So next, we're going to do the evaluation. So we have to collect the data and analyze it. So where is the point? Where is the major key point that we're going to concentrate to develop? And next thing, we're just going to move forward to the other topic.
Well, we all get main messages in our mind after such a course. For me, the 3 main messages will be gap between the different hospitals, will be the necessity for leadership in infection control and hand hygiene in particular, and would be the necessity, but we already got the okay from the government of having a strong support from the government and from the Ministry of Health. So the last of the 3 was obtained, and I think the course will make the difference.